Hello, welcome everyone to my presentation session. Myself, Dr. Nipa, graduated from the Faculty of Associated Medical Sciences, Chiang Mai University, Thailand, and currently I am working as a lecturer at the Department of Rehabilitation Science at Bangladesh Health Professions Institute, an academic institute of the Center for the Rehabilitation of the Paralyzed. My study title is Effects of Pelvic Floor Muscle Exercise combined with core stability exercise among women with stress urinary incontinence following treatment of non-specific chronic low back pain. The urinary incontinence can be defined as per the International Continence Society definition as an involuntary leakage of urine. The prevalence of urinary incontinence might be varied as per the studied population. There was a study in Bangladesh regarding the prevalence of urinary incontinence among the low back pain women, and the study found that about 68.4% low back pain women are suffering with the urinary incontinence. However, there are a number of studies found the significant clinical correlation between the urinary incontinence and low back pain. Low back pain women are at double risk to suffer with the urinary incontinence. Rationale of the study. Previously, a number of studies focused that pelvic floor muscle exercise should be considered as a first-line treatment approach, and there is the highly clinical correlation with the low back pain along with the urinary incontinence. However, there is not enough information on effective intervention regarding the urinary incontinence in respect of chronic low back pain. Therefore, the purpose of the present study was to determine the combined effects of core stability exercise along the pelvic floor exercise in comparison to the pelvic floor exercise alone among women with stress urinary incontinence in non-specific chronic low back pain. The study conducted by the stratified randomized control trial by the age 18 to 60 years of age and pad weight greater than or equal to 2 grams. The study administered by a blinded assessor. The study conducted at the outpatient musculoskeletal unit of the Center for the Rehabilitation of the Paralyzed among the low back pain women who are suffering with the urinary incontinence. The primary outcome of the study considered the volume and frequency of urinary incontinence, whereas the secondary outcome considered the quality of life of urinary incontinent women. For the outcome measurement tools, the study considered the primary outcome volume of urinary incontinence was measured by the objective measurement tool 1-hour pad test, whereas the frequency of urinary incontinence was measured by the Bengali translated and validated incontinence severity index questionnaire. The secondary outcome quality of life of urinary incontinence of the women was measured by the King's Health questionnaire. Experimental procedure. At first, the respondents are recruited by the screening, followed by inclusion and exclusion criteria. Then their diagnosis was confirmed by the 1-hour pad test. If the pad weight was greater than or equal to 2 grams, then the respondents are included in the study. After that, the respondents are randomized by the computer-generated random number with a blinded assessor who was not involved in the research throughout the opaque sealed envelope process, and they are randomly divided into two groups, experimental group and control group, whereas the respondents of experimental group perform the pelvic floor exercise and core stability exercise, and the control group respondents perform only pelvic floor muscle exercise. The exercise was followed up at 1st, 4th, 8th, and 12 weeks of the intervention program. The results of the study stated that at baseline there was no significant difference in between the groups comparing the all baseline characteristics. The primary outcome of the study, which was considered the amount of urine leakage measured by the pad weight, significantly decreased in the experimental group than the control group, considering the p-value 0.004, and the frequency of urinary incontinence was also significantly more decreased in the experimental group than the control group after 12 weeks of intervention, considering the p-value 0.014. The secondary outcome, which was considered the quality of life of urinary incontinence of the women, was also significantly improved in experimental group in respect of incontinence impact, role limitation, physical limitation, severity measures, and effects of bladder problem. As per the intention to treat analysis of the study found that about 84% respondents of the combined intervention group and 28% respondents of the control group cured from their urinary incontinence after 12 weeks of the intervention program. The study findings was in line with the previous studies, which stated that 12-week abdominal muscle training is significantly superior to pelvic floor muscle training for the treatment of mild stress urinary incontinence in obese patients, considering the p-value 0.005. Furthermore, the other study stated that pelvic floor muscle training increased pelvic floor muscle strength and significantly reduced the frequency and amount of urine leakage, considering the p-value 0.04. After completion of 12 weeks intervention, the level of exercise was significantly improved in the experimental group than the control group, which was measured by the pressure biofeedback unit. As per the findings of previous study, it might happen because the lower abdominal cavity formed by the pelvic floor muscle. Therefore, the coordinated activity of the lower abdominal muscle along with pelvic floor muscle helps to maintain the urinary incontinence more in the combined intervention group than the control group. So in conclusion, we can say that the combined intervention of pelvic floor muscle exercise along with core stability exercise is significantly objectively cured the stress urinary incontinence and frequency in the combined intervention than the individual pelvic floor muscle exercise only. These are the references that I have used for this presentation. And thank you so much for your patience.